just a quick review of the Nvorliy knee brace. So this brace is designed specifically for people that are having knee pain or some kind of problem with their knee. The idea here is that you put on the brace and it supports the joint and surrounding soft tissues like the muscles around the knee, and it restricts the knee motion a little bit. So that way your knee has a chance to rest, recover, and doesn't get so overstressed as you're doing things. So a few points about this particular brace. It is for larger plus size legs, so it actually works the same way as any other brace, just everything's just a little bit bigger. It also is made of 35% nylon, which I think is good. Nylon is one of the more durable fabrics out there, so since it's 35% nylon, I would expect this brace actually to last quite a while. And the other thing I want to bring up is that this is machine washable, which is kind of a big deal because you're going to wear this a lot. If you wear it in the summer or you wear it when you're more active, you're going to probably sweat a little bit while you're in the thing. And if you sweat enough, the thing picks up the sweat. The brace does, and then you got about washing it and all that kind of stuff. So it's just nice that you don't have to hand wash this. You actually just throw it in the washing machine and then you're done with it. So that's real nice. So other things you can do if you're having knee pain, I'm just getting this from Bulletproof Your Knee. If you have any kind of a knee pain, make sure you're strengthening, doing at least one exercise for your quadriceps muscle. The quadriceps muscle is a group of 4 muscles, and collectively they're called the quads or the quadriceps. And here's your kneecap for reference, or your patella. So right above there is the quadriceps muscle. Now, this is the main stabilizer muscle of the knee. So your knee, it depends heavily on it to stabilize it. So researchers are finding that you actually, if you have just about any kind of knee problem you can name, probably show you a study showing you that researchers have found that just the quads they're having a problem with. So like for instance, if they test all the muscles, selectively it's just the quads that really take a hit for some reason when you have a knee problem. So for instance, like knee swelling in the quadriceps, another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So here again, if you have any kind of acute swelling, like sudden onset swelling, like you just had an accident or injury, or you just have long-term swelling for whatever reason, it takes its toll on your quads. Knee injuries, it's surgical opening of the joint. If you had knee surgery before, it puts you at risk for having decreased quad strength. Ligament problems in the quads, anterior cruciate ligament. So that's the ACL. You've heard of football players tearing their ACL. Here's good. One study looked at people who had completely ruptured their ACL. Researchers found that the strength of their quadriceps muscle in the injured leg was decreased by 25 to 30%. So here again, you take a muscle that's the main stabilizer of the knee and you knock the strength down, over a quarter of its strength gone. I mean, it's going to be hard to recover or get pain-free if you don't build that back up. Posterior cruciate ligament, medial collateral ligament, same kind of thing. Knee pain in the quadriceps. They find if you have pain in your knee, that can kind of affect the ability of the quads to contract. Here's a good knee arthritis in the quadriceps. So if you Google like knee arthritis and quadriceps, you find it's very consistent in the research that when they look at people that have knee arthritis, they all have quad weakness. So they find that it's just kind of rampant. Likewise, there are actually randomized controlled trials showing that if you take a group of people with knee arthritis and you strengthen their quadriceps muscle, that their knee pain starts to go away. And some of these studies are even finding that the people that have the strongest quads have the least progression of their knee arthritis. So if you have knee arthritis, you've got a lot of good reason to do at least one quad exercise. Patellofemoral pain syndrome in the quadriceps, and this goes on and on. So any kind of knee problem, even if you don't know, but you're just having knee pain, make sure you strengthen your quads. Fine-tune control over your knee. Here they're talking about the hip muscles. Now, sometimes you have trouble with your knee, but there's nothing wrong with your knee at all. The trouble's up at the hip. So classic cases like iliotibial band syndrome. So you take a group of people with iliotibial band syndrome and you strength test their hip muscles. They find the hip abductors are really weak. Now, that's a muscle that keeps your pelvis level every time you take a step, brings your leg out to the side. So here again, like just with knee arthritis, take a group of people with iliotibial band syndrome and you strengthen their hip abductors, iliotibial band syndrome starts to go away. So optimize knee flexibility. Well, we all know that your knee has to be able to bend and straighten sufficiently. A lot of people don't know is that your knee actually rotates. About the last 10 to 15 degrees, if you straighten your leg, kicking it out, it rotates laterally or out to the side. So here's a test to see if you have that motion. So that's what they call an accessory motion that you really have to have for a fully functioning knee. And you can also do some stretches to stretch that out. Increase dynamic knee stability. Here they're talking about proprioception. So proprioception is your position sense. So for instance, if I suddenly turn the lights out now, you'd be able to probably be able to tell me if your knee is bent or straight. And that's because you have receptors in your knee joint and in the surrounding muscles that constantly give your brain feedback as to where your knee is in space. So when researchers go testing proprioception with people with various knee problems, they find that proprioception isn't what it should be. It's not like they don't know where their knees are, because that'd be like a big neurological issue. But it's just it isn't what it's supposed to be. It's not normal. So other things you can improve upon to get rid of knee pain. But hey, nothing's as quick as putting on a brace. This is a good one. So if you have a bigger leg than normal, hey, whether you're just muscular or maybe just add a little bit of weight over the years. I mean, hey, this is a good brace. Check it out.